when you look at what can you do to make people more efficient, the easiest lever to pull is to reduce the amount of drudgery, right? In an ideal world, radiology would entail me looking at a set of images, talking about it, and making my interpretation, having the clinical information there, and then answering the question that the clinician and the patient is asking and providing that. But what does my day to day entail? It involves pulling up a study on PACS, and maybe that PACS is slow and it's not loading very fast. And then maybe the clinical information isn't right there, but it's having to go into the EMR, electronic medical record, and look and find, oh, they had this surgery and this surgery and this surgery, because our forms come in with headache or pain as the whole synopsis of the clinical picture. We don't have the benefit of the clinical exam or all the other information that really adds nuance and adds an ability for us to really diagnose what's wrong. Our job is not to provide a report, but to diagnose what's wrong and help that person get better. And then the last part is the dictation piece. There are no scribes sitting next to us listening to our every word. Much of my day involves typing, dictating, fixing errors, and things like that. And so when you look at structural things, like if you can provide a proper milieu for radiologists to do what they do best, which is to interpret imaging, to apply clinical information to that imaging, and then create a differential that allows the patient to get better, you're going to both increase job satisfaction, you're going to increase efficiency, and you're going to decrease burnout. A lot of times what drives burnout is feeling like you're a hamster on a hamster wheel, not making a difference, right? We all go into medicine to do good, to help people. But the current environment between the way insurance works, reimbursement works, the amount of work, these technology challenges, it all leads to just feeling like you're running faster and faster every day, and yet still not accomplishing what you need to accomplish.